Good morning. We go through different experiences in our life. Experiences never end. We all know that. The question is, what do we learn from them? My journey has been one of experiences, big, small, really doesn't matter, but an experience nevertheless. Recently, I was in a hospital where a very dear person to me was admitted, elderly person. And what we say and what people normally say is that after a certain age, whether it's 85, 90, we say a person has lived a full life. And especially a person who's achieved most of the things that he or she wants, has got support. I mean, that's the best way to be. No one wishes for suffering. No one wishes that anyone goes through health issues which really hamper the last few days or years of one's life. But one can't control that. To a degree, your lifestyle governs it. To a degree, your mind and state of mind governs it. And to a large extent, even genetics play a role. Nevertheless, whatever it is, the person who's going through it and those who are supporting him or her, they go through it as well in a very different way. What I noticed, unfortunately, is that the external support factor, which is within the institution, within the hospital, it could be a hospital, it could be a hotel, it could be anything. But wherever there is a service being rendered, and especially with something which is critical, which is healthcare, now that causes a bit of concern. As it is when somebody is in a hospital, you know it because you've been to one yourself. Tensions are high, stress levels are high, thinking to a large extent goes for a sixer many times, or it doesn't work at all. But if the system in that institution is working the way it should be, where people are following protocols, where people are following standard operating procedures, SOPs, where people are empathetic, every individual working in that institution is empathetic, and a lot of that stress and tension is taken care of. But unfortunately, that doesn't happen most of the time. There are always exceptions. I always say this, there are always exceptions. There are some good people, there are some good institutions which follow this doctrine. But there are many who have thrown this to the wind purely because the maths don't add up. The commercials don't make sense. So all for the sake of commercially being viable, certain protocols, certain SOPs are played around with, and that causes chaos and havoc. I saw this play out for myself, where a person coming out of ICU, intensive care unit, where he has been stabilized, comes into a regular room for observation for a day or two, and then one of those days, the protocol of taking the routine blood tests are forgotten. Now, whether they are forgotten, or they were careless, or they were too overcautious that a physician has to direct the nurse or the staff, the junior doctors over there, to go ahead and do the blood test, or they had other priorities. It was completely ignored. Yes, I will use this word ignored because this is something which is absolutely necessary, and it's an SOP and it's a protocol that somebody who has come out of ICU and is under observation, a blood test is done every day to check for various parameters. And if it's an elderly person, especially who has crossed 90, it becomes even more important, because the repercussions of that can be detrimental. It can be life-taking or life-saving, depending on how the individual in the system looks at it. It was not until we created a big hue and cry, it was not until we escalated the whole thing to the higher-ups did the wheels start turning. But what should have been done in the morning between 7 and 8 or 9 a.m. was done at 1800 hours, which is 6 p.m. And just think, my friends, what can happen? What can really happen if things go south? That particular patient can lose his life or her life. Now I ask one question, is it worth it? Do those people in the institution feel it's worth their reputation? Worth the brand that they've been talking about and has been there for decades? For all those people in the past who worked so hard to create that image and genuinely created that image of care, of an institution which is empathetic towards its patients and their attendants, all go down the drain because of the callousness and the absolute arrogance in many ways of people saying, no one can touch me. Now, why am I sharing this with you? It's because if we don't bring it up when we notice it, in a polite yet affirmative manner, escalate the issues, put it down in writing if necessary, to share as a feedback so that the system improves, not to create a fight, not to create hindrances for the caregivers. One has to remember, and I've been on that side, I know what it is to be on the other side of the table as a caregiver. They face a very different series of challenges on each and every day. Every individual in that institution has a different challenge. But unfortunately, those on the other side, which means the outside world, are not privy to it, so they don't know it. Nor do they care to find out. So it's okay. The question is, do we as individuals know what we need to do? Do we know our SOPs? SOPs of life, SOPs as caregivers, SOPs as care supporters. Do we know what are the protocols? What is expected of us? That is important. What someone else does is completely out of your control. What is in your control? Can you do that diligently? Can you do that with a heart? Can you do that with a clear conscience that you've covered every aspect of the SOP? You've done what is best in time and then wait it out. That's perfectly fine. So I leave you with this thought, my friends. When you face certain things like this, what would you do? How would you, as that one individual, act, behave in a humane manner, in a polite manner, to not only point it out to those concerned, but also be a catalyst to bring about that change for the better? Give it a thought. Have a lovely day.